Hi, and welcome to another episode of Ask on CYC. So your heart is used to love, and as Christians we are taught that Jesus lives in our heart and teaches us how to love. But it also has many other qualities that helps us to come and be in existence. So tonight on tonight's show, we're going to look at it in a physical and a medical point of view, and we're going to look at how to love our hearts and care for it and look after it to reduces our chances of getting high cholesterol and in order to stop from getting heart attacks. So please tune in. I want to introduce you to tonight's guest, but before I do so, a reminder that our phone number is 0416 551 292. So please send us a text or give us a call and speak to our cardiologist on tonight's show. So let me introduce you to our cardiologist. We have with us Dr. Peter Fahmy.
Thank you for having me on the show.
Welcome to the show. It's a pleasure having you on Ask.
Thank you.
So let's get familiar with you. Give us a bit of a background about yourself, study and work.
So look, I actually did all my medical training school-wise, university-wise, was in the University of Otago in New Zealand, in Dunedin. And then after that, did my internship also in Dunedin and moved to Sydney at that time. Did all my basic training, so we call them basic training, and then went into cardiology training in Melbourne, and then did subspecialty training in actually Vancouver, Canada. In addition, on the road, I did a PhD as well and got my doctorate in medicine, Doctor of Philosophy with Sydney University.
Okay. All right, so my first question, and this is probably one of the most important questions I want to ask. I want to kick off the show with this question. So, can someone suffer a heart attack from a young age?
Yes, absolutely. Look, I think we don't understand that people just as young as us, do suffer from heart attacks. The patient I've had, the youngest I've had, was a 28-year-old gentleman who actually needed a bypass operation. But in addition to that, I've had as young as 16-year-olds having heart attacks. Nevertheless, these young 16-year-olds usually have a genetic component to it. But people as young as their mid-20s, early 20s can suffer from heart attacks. And it's really because of genetic issues, and the genetic issues usually are cholesterol or obesity or other lifestyle factors that would contribute to all this sort of risk increase for a heart attack.
So for the young people who had an understanding that, no, I shouldn't care for my heart now, I still got a while before I should worry about heart attacks, this is a misconception and it should be stopped.
Oh, look, absolutely. Look, there is a slope that just increases slowly of whatever you're doing, causing things to your heart. So there's risks involved. So risk factors of causing a heart attack are your things that we can't change, being a male. But things that we can change are lifestyle. So lifestyle is things like smoking, your exercise, your diet. And there's other things that are medically able to actually modify, hypertension, and also your hyperlipidemia, so your cholesterol profile can be reduced with medication. So all that is essentially a crescendo. So if you start looking after yourself from young, you expect that cholesterol will not build up on your arteries as soon as possible. It takes a while for it to actually build up and cause a problem. So if you start actually having junk food at a very young age, well, that will all contribute in the future. So even when you stop and you start changing your lifestyle, you may not always get a regression, but nevertheless, at least it will stop that slope increasing. So the sooner you stop, the better it is.
Okay, so for argument's sake, let's throw an average age where most people get heart attacks.
Oh, now you're talking about sort of in their 50s and 60s. These are people that's usually the average age of people having heart attacks. Okay. In their mid years, in their 50s, 60s. It all depends also on their genetic profile in addition to the risk profile.
Sure. Okay, so what's the difference between a heart attack and an angina?
Oh, look, the difference is the pathophysiology. The pathophysiology as in how it occurs. So angina actually takes years. Angina is a result of cholesterol and plaque build up on your coronary arteries. So that takes a while for it to build up. Essentially, once the blockage reaches 70%, so think of plumbing, really. Think of a plumbing. So we really, interventional cardiologists we call ourselves fancy plumbers. What we do is we try and clear the arteries in the heart, and that's all we really do. So we clear it up with a stent and a balloon and open it up. So what we're actually opening up is plaque and cholesterol buildup that's actually occurred over years. That's when you start getting angina, when it actually hits around 70% blockage. That's when people start developing chest pain or chest pressure that you hear of all the time, and that is a definition of angina. Heart attack is different. Heart attack, you don't necessarily have to have that 70% blockage. What happens is from that plaque, a rupture happens. That rupture basically occludes the heart artery completely, and that's when you get a heart attack. So they have different pathophysiologies or different sort of methods of getting to that point, but nevertheless, the person who has angina could, obviously, if it keeps getting more and more blocked, would eventually get a heart attack.
Okay. Just a reminder to our viewers, please, this is your opportunity to speak to our cardiologist on tonight's live show. So if you have a heart condition or you're worried about something, please give us a call or send us a text and get your answers on tonight's show. And the phone number is 0416 551 292. This is your opportunity. Don't miss out. Please send in your questions. So I know you mentioned earlier what happens to a person's heart to cause a heart attack, but let's talk what happens to the rest of the body during the heart attack process.
Oh, look, it's the consequence of a heart attack, or whenever you get these blockages, people develop several symptoms. So some people feel short of breath. You get the chest pain because of the blockage and the reduction of oxygen supply to the myocardium. So myocardium is a muscle in the heart. So chest pain, shortness of breath. Some people feel dizzy. Some people get palpitations, so heart flutters. And eventually what will happen, you'll start sweating, you'll get diaphoretic, pale, and you may or may not pass out as well, depending on the severity of the heart attack and how much of an occlusion of the coronary artery is occurring. Essentially, you've got three main coronary arteries. You've got a front, a left, and a right. The front one, if it occludes very proximally, we call it a widowmaker. So a lot of people don't survive unless they come into hospital as soon as possible. So there's all these campaigns by the Heart Foundation. If you feel that you've got chest pain, you need to call an ambulance. You need to come to hospital. You don't just sit on it and wait. You need to come to hospital. Time is muscle. Time is muscle. So therefore, the earlier you get in, the more muscle we can save.
Okay. So do we get any signs? Like, does a person know they're about to get a heart attack, or is heart attack a sudden thing where you're not aware that it's happening, or is it a build-up of symptoms that you experience over time to give you an idea, hey, I'm about to experience a heart attack? Or
everyone is very unique. So most people probably had some sort of sign in the last couple of weeks or last week that there is something going on. And usually it's a bit of angina that they're getting. So they're actually feeling chest pressure, but they don't realize this is their heart that's causing it. They actually think it's reflux or something is going on in their gut that's causing it. And it's actually building up and getting worse. And then that leads then to a heart attack. But there's a significant portion of people that just happen suddenly. And it's just a sudden occurrence without anything that they've actually noted in the last couple of weeks. Although if you sit them down and actually really interrogate them, there's usually some sort of subtle sign that's happened over the last few weeks to months that would explain or give you an idea that something is going to occur.
Okay. It's very interesting that you say that, because I know, coming from an Egyptian background, where our men are very cultural and stubborn, and they always push past any health hazards, and they say, don't worry, I'm good, I can continue working. So this is something that we need to, break past, especially our younger generation. So if we feel any problems in our chest, you think we should get it checked up?
Yeah. Look, the likelihood of a 20-year-old having a heart attack is very low. Nevertheless, there is no harm in seeing your GP, or if you are concerned that you're getting chest pain, especially if it's lasting, say more than 10 to 15 minutes, it's not going away, there's no harm in just calling an ambulance. They'll come, they'll do an ECG, they'll check you out. If they think it's nothing, they'll probably leave you at home and not do anything. If they're concerned, they will take you to the hospital. So leave that decision to someone in the health profession. So there's no harm in calling an ambulance and getting them to come and have a look. Okay. It will save lives. It will absolutely save lives.
Yeah. All right, so let's get into detail. Yeah. Throw it all upon me, don't hold back. What can cause a heart attack?
Oh, look. So as I said, there's modifiable risk factors and there's non-modifiable risk factors. And I usually separate the modifiable ones into lifestyle and medications. So the non-modifiable, genetics, being male, these are the two sort of major non-modifiable risk factors that can occur. Then we're getting into risk factors that can be modified, so those with hypertension, so increased blood pressure, increased cholesterol, those that have diabetes, all those are medication sort of modifiable risk factors. Now the ones that I'm talking about lifestyle that you need to change are things like diet, obesity, really smoking. Smoking is still an issue. People think that smoking is no longer becoming an issue, but really there's a lot of young people that are smoking, and they're using the newer cigarettes or newer filtered, what they call filtered sort of smoke, which still actually increases the risk of cardiovascular issues. So those three categories, as I said, were probably the major risk factors for heart problems.
Sure. Look, I want to ask you, what advice would you give after a patient goes through a heart attack? But every condition is different and every advice is different. But what kind of general advice would you give to patients who just walk out of the surgery from you?
So nowadays we've proven there's something called cardiac rehab in every hospital, and they should be able to provide it to you. What they undergo, and it's shown that it actually does help, they give you advice on diet, they give you advice on exercise, they give you advice on what symptoms to look out for. So dietary things, what the guidelines always say, you need something like 2.5 servings of vegetable, you need 2 servings of fresh fruit every day to satisfy, to sort of say that you reduce your risk of heart problems. And things like broccoli and cauliflower actually have increased a better outcome to reduce heart problems than other types of vegetables actually. They call them the seriferous, I think, vegetables, if I'm correct. Other things, we always give them advice on cessation of smoking. This is very important. You mentioned what can affect things starting at a young age. Smoking is a big factor. Just starting at a young age, it's increasing your cholesterol buildup and your plaque buildup in your arteries. Even though you stop it, you can't necessarily regress it back to someone normal. Maybe it takes 10 years to come back to what it was for someone who's non-smoking. But if you start again, it'll start increasing again. So a lot of people stop and start, stop and start. Just stopping doesn't mean it's going to start going down and then go up. It usually plateaus and then goes up again. So smoking is a huge issue. And smoking has shown that when you, after a bypass or even after stents, you have increased risk and morbidity and mortality if you continue to smoke. On the stent, on the grafts that were put in, some of them may, there's increased risk of going down of both the grafts and the stents. So it's a major issue, smoking.
Yeah. I want to talk more about smoking later on in the show, but specifically Shisha.
Yeah.
But for now, let's talk about cholesterol. How can we tackle cholesterol problems?
Very simply, you need to reduce your amount of cholesterol in your diet. That's the best way. And increase your exercise, because that will reduce your cholesterol. Also exercise will reduce your blood pressure. So as a matter of fact, the advice we always give everyone is 20 minutes a day of exercise. And I'm not talking about 20 minutes of just walking at a leisurely speed. You really sort of push yourself a bit. Like you need to sweat a bit at the end of those 20 minutes. Somewhat, like you have to increase your heart rate a bit.
So talking about exercise, what is the average amount of time a person should dedicate to exercise a day in order to prevent themselves from...
We have guidelines. So the guidelines actually say intense exercise of around 75 minutes per week, moderate amount of exercise of 170 minutes per week. But really the advice I give everyone is all you really need is between 20 to 30 minutes of some sort of exercise every day. And
walking is sufficient, yeah?
Walking is sufficient, but brisk walking. I'm not talking just like leisurely walking and window shopping or something like that.
Yeah.
No, brisk walking, yes.
Yeah, okay, that's very interesting. So so we need to start dieting.
Yes.
In order, so when I mean dieting, I don't mean like diet to lose excessive amount of weight. I mean diet in order to eat healthy.
Yes.
To lower cholesterol. But as Egyptians, that's a problem.
It is a problem. I mean, I do agree. The food that we cook, I must say, I don't know exactly all the ingredients. I'm not the best chef.
A lot of oil, a lot of bread, white bread.
So all that is increased in carbohydrates and the butter. You need, basically, I always advise everyone, use low fat. Milk, low fat. Yogurt, low fat. Anything that you can get low fat is the way I would go. Reduce your cholesterol. Some people eat a lot of eggs. That's very high in cholesterol. You need to reduce that.
But we're talking about the yolk now.
Yolk.
The egg whites is fine.
The egg white doesn't taste.
Fine, yeah.
Correct.
I just recently started buying egg whites on its own.
Oh, okay.
Just to lower,
so the egg white itself is actually not, actually not bad. Yeah.
And I'm very health conscious, especially about cholesterol.
But, you know, you mentioned weight. Weight loss is very important as well. So you need to achieve the ideal body weight. So we've come out with a, well, not we, like there's a medical body mass index, it's called. It's weight over height squared. Weight in kilograms, height in centimeters. And normal is between 20 and 25. So you need to try and get your BMI to into that sort of ratio. It's actually different for different races. It might be a bit lower for Asians, a bit higher for African American. But in general, it's between 20 and 25. The reduction of weight actually reduces both the risk of diabetes and your blood pressure. So some people who are significantly obese, if they actually reduce their weight significantly, they can come off diabetic tablets, come off antihypertensives. So weight is important. There's a circumference as well of 102 centimeters that we advise people. They need to be less than 102 centimeters in males.
Yeah.
The circumference around the waist.
Okay.
So that's two things you can
so
use
all
as
this
a
stuff
guideline.
adds up in the end.
Correct. Absolutely.
Oh, okay.
Heart disease is not just one thing. It's multiple risk factors that contribute. So everyone has a significant contribution to it, and you need to reduce them all, essentially, to reduce that contribution significantly.
Okay, very interesting. We're going to go for a quick break, and when we come back, we'll continue our discussion, and we'll talk more about the whole smoking, shisha, and all these other issues that cause heart problems. Yeah. Just a reminder to our viewers, please, if you just tuned in, the phone number is 0416 551 292. Please, we have a cardiologist on board on tonight's show. If you have a question, about shisha or smoking or anything that leads up to heart problems, please send in your questions through a text or give us a call. And don't forget, all your questions, you remain anonymous. No one will know who you are, so please send it in 0416 551 292. Thank you.
CYC, Christian Youth Channel.
Hi, welcome back to Ask on CYC, where we're talking about how to look after your heart physically and medically speaking. So please, if you have any questions, send in your questions to 0416 551 292. So let's get back into it. We actually got an audience question that came in while we were on break. They're asking, what are the ramifications of drinking coffee? What effect does coffee have on your heart? How many cups a day is it too much? And is drinking coffee before going on a run bad? Okay.
So look, coffee, the question that you're asking is basically caffeine. What does caffeine have on the heart? What it does is it's a stimulant. So there is a significant portion of people that may feel, especially depending on how much coffee you're actually drinking and how fast you're drinking it and the intensity you are drinking it, you can get palpitations. So that's the real issue that people get. It's this feeling of heart flutters in the heart. In general, it's a benign issue. In general, it's a benign issue. But if you're starting to get these, the best thing for you is to reduce your coffee. You don't want any problems, really. So you try and reduce your coffee. So exact amount of cups, there is no guideline on how much you should or you shouldn't drink. It's more a relative thing. So whatever you're drinking and you're starting to get these palpitations or starting to get discomfort, you need to reduce. Drinking coffee before you run, again, you're just stimulating your heart before you run. That's all. I mean, it's better not to be having your heart stimulated before you run because you're going to increase your heart rate anyway. But as a rule, I don't think it'll cause much of any harm.
Excess caffeine takes no toll on the heart. So let's move away from coffee and talk about more on energy drinks.
That's a different story.
Okay.
Yeah. So those energy drinks are very bad for your heart because there is a significant amount of caffeine in such a short burst. These cause significant catecholamines or triggers that will increase your heart rate and can cause cardiomyopathies. So they're actually quite bad for you. So you can get cardiomyopathy. So cardiomyopathy is weakening of the heart muscle, and therefore the pumping action of the heart is reduced. So those, especially the very high intensity ones, I think they come in like these shots. They're terrible. And in general, if you're taking them, you will get palpitations. You will feel a bit of palpitations. So these, I'm completely against these V and Red Bull and all those. I don't think they're good for your heart at all.
Have you experienced any patients who came in because of excess energy drinking?
Personally, no, I haven't had. In general, I've been dealing with all my patients were coronary problems, blockages. My colleagues who are rhythm problems would probably have a lot of patients that are like that.
Okay.
Yeah.
Because on the can, it actually advises you maximum 1 can a day or maximum 2 cans a day.
Yeah.
But a lot of young people, especially during the exam period, they're drinking it like it's water.
Yeah, no, that's completely inappropriate. As I said, it's the palpitations and the catecholamine increase that you're getting, or the stimulant increase you're getting towards your heart, and getting a significant sort of a heart rate that's going up. There are illnesses that if your heart rate stays at a raised level, that's what weakens the heart. So a continuous load or a sudden load, binge loading, I do believe is actually not very good for your heart at all.
Okay. All right, so let's get back on smoking, and let's talk more specifically on Shisha. The reason why I want to be specific and talk about Shisha, because smoking, yeah, people are into it, but people understand the ramifications of smoking a cigarette. But what people don't understand is the ramifications of smoking Shisha.
There's a misunderstanding. People think that Shisha is filtered through water and therefore it is safe. It's completely incorrect. Smoking Shisha is equivalent to essentially 100 cigarettes. Equivalent to 100 cigarette smokes. So it's actually a significant increase of risk factor for your heart. It will still have the same effect as smoking 100 cigarettes.
So what does it actually do to your heart?
It's the same as a cigarette.
Okay.
Increases your plaque rupture, increases your plaque, build up, and cholesterol emboli build up. All those, specifically plaque build up, exactly like a cigarette. So, but it's equivalent to now 100 cigarettes. In addition to all the other health ramifications of smoking, such as cancer and dental issues.
Yeah. So you mentioned earlier about this electronic cigarette, the vapor.
Yes.
So people think that that's a more safer option.
You know what? There's not enough studies yet to understand exactly what's going on with these vapor. But the small ones that have come out have suggested that they're not actually good for you. But numbers or actual absolute risk, it's still not as...
Yeah.
I would still recommend not having any of those either.
Sure.
I think.
Shisha, vapor.
So even the people who say 1 cigarette or 3 cigarettes, no.
How about if you're standing next to someone who smokes?
So you know what? There is some studies, and they've shown that if you are getting a lot of secondhand smoke, that increases your risk as well for heart problems. But obviously this is relative, you know. Living with someone who smokes is different to, say, you're walking on the street and someone was smoking while you were passing by them. Yeah, so it's all a relative type issue.
Okay, so if there are parents out there who smoke, make sure they step outside of the house.
Yes. Because
young children are more fragile.
Correct, absolutely.
And their hearts are more fragile.
It's why the government has now said that no one can smoke inside restaurants and all that.
Yeah, okay. Let me ask you, it may sound funny to you, but to the people out there, it could be a serious question. Sure. So can breaking up from a relationship cause problems to your heart?
Yeah, psychologically, I'm sure. Look, from a physical point of view, there is something called a broken heart syndrome. The medical term is Takotsubo Cardiomyopathy, obviously by, I think, a Japanese guy who came up with it and probably described the first few cases. Look, this is usually a sudden loss or a sudden emotional breakdown that would cause something like that. So a death in the family, a sudden death in the family that wasn't expected. It is quite possible that if you are in so much, in love so much and suddenly break up, that this causes such a huge effect on you that you'd get this Takotsubo cardiomyopathy. And the result is the catecholamine increase. Well, we don't actually understand it very well. We think it's because of this catecholamine increase, resulting in some muscle abnormalities and muscle damage and reduce the heart function.
But these are severe cases, but generally speaking.
I don't think so. No, I don't think so. Unless you're a very sensitive person, then that maybe.
Yeah.
But in general, no. But I know people who say when they lose their job, well, that was enough for them to have a Takotsubo cardiomyopathy. But actual relationship breakups, I must say, I've not had a patient yet.
So why do people grab their chest area?
I think
they're in pain.
In general, this is more of an anxiety thing.
Okay.
So panic attacks and anxiety attacks can mimic heart problems, and you do get chest pain.
Sure.
So I think that is in general what people sort of feel.
Okay. So I want to ask you now about a pacemaker. What is the job of a pacemaker, and who would it be inserted for?
You know what? Pacemaker is a very simple machine. All it does is, all you basically tell it is, I want you to keep the heart rate above a certain amount, say 60. So if the patient's heart rate drops less than 60, it kicks in and starts beating the heart. So it's a life-saving machine for those that their heart rates drop below 30 and they can pass out and can have problems, who just suddenly lose electrical activity completely in their heart. And it brings them back to life, essentially. So anyone with a bradyarrhythmia or electrical issues in the heart that causes their heart rate to drop and makes them feel funny, or they can pass out, these are the patients who require a pacemaker. And all it does is just it kicks in once the heart rate drops a certain amount.
Okay. We talked about a lot of physical issues, but can stress take a toll on someone's heart?
Yes, look, I think stress will contribute to blood pressure issues, and blood pressure contributes to heart issues. So in a sort of a simple answer, yes, in general, those people who are more high-strung are more likely to have increased blood pressure, and it's the increased blood pressure that is likely to cause the heart issues. So they're all related somehow.
Okay. I actually just got a couple of questions that came in from the audience members. They're asking, some signs for heart attacks are unusual, such as backaches. So how do you know if you're actually having a heart attack?
Yes, look, everyone experiences heart pain differently. I mean, the book tells you get chest pressure or someone sitting on your chest. That is not a common occurrence. In general, it's actually very rare. People get shoulder pain, people get tingling and numbness in their hand, and some people get back pain. It's what is different to what you've felt before. If you've had back pain before and it's been diagnosed that it's sciatica or musculoskeletal pain, well, then it's unlikely, if the same pain occurs, that it's your heart. If the character of the pain has changed, well, there's no harm in getting it checked out. Again, I think if the pain is, if you feel it, especially if it's associated with other symptoms, so like shortness of breath or palpitations or dizzy spells or feeling diaphoretic, all those associated symptoms would lead more to heart than just a simple back pain. But in my opinion, if you are concerned, just go and see your GP, or if you're really concerned, call an ambulance, let them check you out. It's very simple. They'll come to your house, do an ECG, have a look. If they're not concerned, they're going to leave you at home.
Okay.
And you'll know that it's not your heart.
Yeah. Another question they're asking, how successful in terms of patient acceptance are heart transplants?
So is he asking that the transplant has been successful in
Now,
that?
how successful in terms of the body not rejecting?
Oh, look,
Generally,
we've come a long way. My specialty is not in heart transplants, so I can't give you exact numbers or anything, but we've come a very long way now since, with all these new drugs that we've come up with. So I think in general now we're matching them very, very well. The likelihood of the heart taking, so as in it's accepting its donor and sort of the transplant recipient, is very high. It's very high.
Okay.
We keep those patients in specialized hospitals, looked after by specialist teams. They can pick up if there is any signs of rejection, and they can treat it.
Yeah.
I think it's very successful in this day and era.
Actually, I got another question that just come in, very interesting one. They're asking, what is one fact about the heart that is not known to many people?
What is one fact?
Yeah, it's interesting. It'll get you thinking.
It's getting me thinking, that's right, yeah.
You want to come back to it?
Let's come back to it.
We'll come back to
let's
it.
come back to it.
Okay, another question is, how fit would one need to be in order to have a resting heart rate of 48 beats per minute?
Yeah, you're quite fit, actually. So as long as you're not on medication and cheating that way, in general, yeah, you're a reasonable athlete. So, all these Olympians, their heart rate's usually in their low 40s, high 30s, and there's no issues at all. That's how they're coping. And that's how they're so fit that they don't need to pump that much blood to their body. So, yeah, if you're sitting at 48 at a young age, I think, generally, I'd assume you're somewhat of an athlete. Yeah.
Okay. I got a final question, but if you feel free to, if you know anything you want to answer to the audience about something we don't know about the heart.
Yes.
So I've got a final question to end the show. And I want to talk about this because this is a very serious issue. I spoke about it last week on last week's show with a doctor when we asked general medical questions. And he actually, when he found out I had a cardiologist on the show this week, he actually encouraged me to ask this same question on tonight's show. So we have a very big trend happening now worldwide, especially here in Australia, which is called the snack pack.
Oh, yes.
You've heard of the snack pack?
Yes, I have, yeah.
So it's got the chips, the cheese, the meats, and the sauce that you can. Eating this snack pack, I can feel my heart stopping. It's just ridiculous, the amount of meat, the amount of sauce, sugars, cholesterol, oil. The oil just fills the bottom of the container. Now, I had this maybe once, and I probably have it once a month or even more than that. But there are people who are regularly having this, and I'm talking about 3 to 4 to 5 times. And I know these people's names, and I know who they are because they're very...
increasing your cholesterol levels, increasing your content of fat, and therefore again not contributing at all, because most people that are actually eating all that are also more of a sedentary lifestyle. So look, in general, this is, it's like the junk food. It's basically part of the junk food profile. You're going to increase your weight. You're going to have an increased risk of having diabetes. Your cholesterol is going to go up. With weight increase, there's also association of hypertension and blood pressure issues. All that is a contribution to heart disease. So most certainly, this is something we need to reduce in our young people and in the population in general. Look, I do believe in quality of life. So there's some things that people really want to eat. As I said, the term relativity. Eat it in huge quantities, in small, modest, minor quantities. And then if that makes you happy, then so be it. It's something that makes you happy. But in a regular sort of your heart, especially in the long term.
Okay, I'm glad.
These things don't happen. These things don't happen overnight. It's building up slowly.
Yeah.
Like in general, someone at sort of in the sort of 30s, if you do an autopsy, you probably see some plaque of some sort in their heart.
Sure.
Yeah.
Okay, that's all we have for tonight's show. I'd like to
you.
thank you for being on the show and giving us your insight on this. I hope you've gained something from tonight's show. I'm Ibrahim from your CYC studio in Sydney. Good night and God bless.